Scleroderma patients are either going to present to the rheumatologist first, where they have complaints such as skin thickening, Raynaud's phenomenon, digital ulcers, muscle involvement, or joint discomfort, and it's up to the rheumatologist to recognize that the patient may in fact have interstitial lung disease. Sometimes they may not even know that they have interstitial lung disease because they're living a very sedentary lifestyle. So it's very important that the rheumatologists who's seeing these patients are screening for interstitial lung disease with HRCT, pulmonary function testing, because interstitial lung disease is the leading cause of mortality in scleroderma. On the contrary, a lot of patients are presenting to the pulmonologist with interstitial lung disease, and it's important for the pulmonologist to recognize that the patient may in fact have scleroderma. Sometimes it's obvious when they have extensive skin involvement, but sometimes the extrapulmonary manifestations can be more subtle. And so treatment strategies for scleroderma interstitial lung disease are different than for idiopathic pulmonary fibrosis. So forced vital capacity is really our best surrogate for overall lung function, and it does track with what we see on chest CT. It does track with survival, and this is an orphan disease. It would be a little difficult to power and design the study to be a mortality study. So forced vital capacity at this point in time is probably our best surrogate in all comers with interstitial lung disease. Well, I think that's a valid point. I think we will have some data to inform the stability of the treatment effect that we saw in the SENSCIS study. SENSCIS On is a continuation study for this trial, and the vast majority of patients did roll over to the continuation study, so we'll be able to follow these patients for a number of years following on open label, granted limitations to an open label study, but we'll be able to follow these patients for a number of years following completion of the SENSCIS study to kind of see, how they behave long term. So we'll have that data. I anticipate that there will be real world registries of scleroderma patients that get treated. There are a number of registries that exist right now. The USTAR registry is a very, very large European registry of patients with scleroderma, not just scleroderma interstitial lung disease, that are tracking all aspects of disease. And I think that registry will help make these data more robust and will make it applicable to the quote real world setting.